I think one of the important things with the way healthcare is going, I mean, obviously in politics, there's a signing of the new bill, which actually probably has some healthcare reform in it. I don't exactly know what that entails yet, but I do know what we've seen over the past, couple of years, individual deductibles, family deductibles, that used to be, in 2012, 2013, maybe $500, $500 family deductible to $750 family deductible. Those are now, $3,000, $4,000, $5,000, which really makes, if you don't go to the, families don't go to the doctor very often if they don't have emergency room visits or any kind of acute care, or any kind of like chronic long-standing care where they're spending a lot of money on healthcare. They're not really going to meet those deductibles, or they're going to have to go to the doctors a lot to meet those deductibles. So one thing that we've done here at the office is we've created cash plans for those families that have those high deductibles. Individual cash plans, if you don't have a family, or if you just want to come individually, obviously, you can get a cash plan for if you want to come twice a month, just for the for the adjustment. Those cash plans, actually, you're getting quite a bit of savings right there. For families, you can get, again, that's, if you get over 6 visits, I mean, you're getting quite a bit of savings right there. And again, the purpose of providing, I probably should have started with this, the purpose of providing chiropractic for the entire family, and keeping in mind that, that we are considered, first line, like a first line clinic, your access point to healthcare, much like primary care physicians in Ohio, is we can handle a lot of the smaller complaints or a lot of the things that most people, deal with on a daily basis without it elevating to point of going to a specialist. So, if one would need to go to an orthopedic surgeon, we can give you that referral if we felt that it was necessary, or if we needed to get an MRI, or if there was something more serious going on. But most of the things that we see, I mean, even though they're important and they affect you on a day-to-day basis, obviously headaches, back pain, but things that even focus in onto digestion, bowel and bladder habits, just a lot of things that people deal with on a regular basis. You should probably see your chiropractor. You can see your chiropractor with those issues, and usually probably easier to get into these days than getting into your primary care physician. It's probably a better use of your money, and I think that your results will probably be better as well, especially if one doesn't want to focus on, using pharmaceutical help or whatnot. So if we get the family, children, adults, everybody in the family can benefit from chiropractic. Again, musculoskeletal, neuro, I think it's probably a very strong strategy to at least consider, versus just going to your primary care physician. And then the savings and the value of what you're going to get on one of the monthly plans is going to be probably more beneficial to you than what your healthcare is providing to you. Obviously our main focus is, adjusting the spine or manual therapy or massage for tight, sore, tension, spasm muscles. But other therapies that we provide, obviously interferential stimulation, so we can put the pads on you. Again, those would be great for people that are experiencing acute or increased pain. We also have foot detoxification baths that we can do for people. Again, ionic detoxification. Look, if you can tell that something works by how awful something looks afterwards, that is something that people should be interested in, because it's pretty amazing, and people feel energized when they get it done. We also, we have a red laser light to help with vascularization of soft tissue. We have the whole body vibe to help people with their balance and proprioception, especially if they're feeling a little bit unstable. Also really good to rehab any kind of ankle sprain, knee pain, foot pain. We also obviously want to help people that, athletes that are experiencing any kind of tightness, stretching programs with focused stretching exercises on to rehab anything that might be inhibiting what you're doing in your sport. So we offer a lot of things. I mean, we have a lot of knowledge. We have a lot of nutritional knowledge for people who are suffering from either migraines or digestive issues or bowel and bladder problems that we like to employ as well. So there's a lot of options. I mean, generally we don't even know what we won't tell you until you ask us. So again, a lot of knowledge here, a lot of knowledge at the office, a lot of knowledge that people just usually aren't aware of that we just think that most people are aware of. But if you have any questions on any number of subjects, at least we'll be able to point you to, if we can't answer it, if we don't have a comprehensive answer, we will definitely point you in the right direction or get you to a resource that will that'll benefit most people's issues or most people's problems.